Well, good day and welcome everyone to Cochrane Canada Live, the research webinar series brought to you by the Canadian Cochrane Centre. As part of our mid-2011 series, we are presenting Webinar 1, talking about Cochrane and systematic reviews as part of the Cochrane Thursdays in June. Before we get started, I just want to acknowledge the funders of Cochrane Canada, those being the Canadian Institutes of Health Research, in particular, the Knowledge Synthesis and Exchange Branch, as well as seven of our institutes connected with CIHR who support us. Thank you for your support during this funding period. I also want to acknowledge the Pan American Health Organization, that is the regional office of the WHO for the Americas, to the Research Promotion and Development Division, providing Illuminate Live to us to be able to conduct these webinars. Thank you to PAHO. And before we get started, I just want to orient you a bit to the features of Illuminate so that you are able to participate during today's session. As you can see here on the whiteboard, I have a snapshot of where your name appears in the participant window to the top left. And just underneath that, if you want to ask a question during today's session, and I have certain points at which I will take questions, all you need to do is simply click on this button, and that will form a queue in the participant window, and then I will instruct you to ask your question. And you can ask your question at that time. There are also a few emoticons, so during the session, if you want to send me a happy face, or if you're unsure about something, this sort of gray wriggly face icon here is a confusion, then please feel free to do so, and I can address those emoticons as they come through. During today's session, we will also be conducting some polling. I have a few questions for you that I want just some information on. So at that time, this is where you would go to select your answer. And just so that you're aware, once your answer is selected, you won't see it appear in the participant window, but the system will register it, so you just have to click on it once. And then once I have a number of responses come through, then I'll publish the aggregate results to the whiteboard. Now, if you're joining today's session without a microphone, or you choose not to use your microphone, feel free to insert questions into the chat room, and feel free to do so ongoing, and I'll adjust your questions when it comes time during those specific points. And just remind you of the format of today's webinar. It's one person's audio activated at a time. So yes, if you want to ask a question or comment on something, raise your hand, and I'll let you know when you can come on to ask a question. I'll release my audio. To the bottom left, you should see this little icon here, a microphone button. All you do is simply click on that with your mouse, ask your question, and then I ask you to click on it again, and then that releases your audio so that I can come back on to answer your question. So to provide a few session tips for today, we won't be able to provide sort of any audio or connection assistance during the webinar, but if you notice that there is an audio delay while you're listening, and it doesn't improve within a reasonable amount of time, simply log out and log back in again, and it should rectify that for you. If you notice a brief interruption in the audio stream, not to worry. Illuminate keeps a little bit of backup recording, so if you notice there's a little bit of a pause, and then it starts streaming again, then you know that you won't miss anything. And as I mentioned, yes, you can add questions into the chat room ongoing. Great. So why don't we carry on, and just to introduce myself a bit, I'm Adrienne Stevens. I'm the Education Coordinator with the Canadian Cochrane Centre, and I oversee education and training for conducting reviews mainly for Cochrane Canada, the Canadian Cochrane Centre. So to take a look at our agenda, we're going to look at who and what is the Cochrane Collaboration, starting off, and then we'll look at the importance of systematic reviews. And then I want to touch briefly on ways to get involved, because I don't think folks are quite aware of the ways that they can become involved with Cochrane. And so I just want to know from you, and I have a sense of where you're from, and in fact I'm quite pleased we have folks from coast to coast in Canada, throughout the US, in the Dominica, the UK, Italy, Pakistan, and Northern Ireland who are interested into this series. So welcome to all of you. But can you let me know, joining today, are you a researcher, a healthcare professional, a librarian, a policymaker, or maybe you fit into another different category. If you can just make your selection right now underneath the participant window, you should be able to just click on that once. It'll come through to me. And then once you've had a chance to select your response, I'll then publish the aggregate results to the whiteboard. So I'll just give you a moment to make your selection. Just curious what type of people are joining on today, what different perspectives you might be bringing to the session as I'm talking through some items. Okay, and some I appreciate maybe you may fit into more than one category, so I apologize for that. It only takes one answer actually through the system. Okay. So I'm just going to publish the results, and some people added their information actually into the chat room, so thank you for doing that. So we have some researchers, we have some policymakers. It's great to have you a part of today's session. Quite a few that are other, and you can actually just insert that into the chat room for me too. Just let me know what type of person. I know we have some students who are learning about Cochrane who have joined on. That's great to have you a part of the session. And I have an indication that we have some healthcare professionals with us here. And yes, some people have multiple perspectives here, so that's great. We have a journal editor. We have a consumer here. It's great to have you as a part of the session. Okay, so quite a few perspectives here. That's wonderful. And I'm just curious to find out how many of you have read a Cochrane review before? And I'm just going to just change the selections here on the participant window, so you should be able to, add your check or X in. So I'll just allow you a moment to do that. Okay, so I'm just going to publish the results, and most of you have. That's excellent. Wonderful. So you're quite familiar with Cochrane. So hopefully what I'm able to present will just sort of complement the information that you have. And so I just want to start with first things first, talk a little bit about the history of Cochrane, and give recognition to where it's due. And of course the collaboration is named after Archie Cochrane, who was a British medical researcher who contributed to the development of epidemiology as a science. In 1972 he published a book that was quite influential, and it was titled Effectiveness and Efficiency, Random Reflections on Health Services. And in it he suggested that because resources would be limited, that they should be used to provide equitably those forms of healthcare that have been shown in properly designed evaluations to be effective. And in particular, he stressed the importance of using evidence from randomized controlled trials because these were likely to provide much more reliable information than other sources of evidence. And his propositions were soon widely recognized as important by consumers and health professionals alike. And in 1979, he wrote the quote that you see on the screen here. It's surely a great criticism of our profession that we have not organized a critical summary by specialty or subspecialty, adapted periodically of all relevant randomized controlled trials. And his challenge led to the establishment in the 80s of an international collaboration to develop the Oxford database of perinatal trials, or also known as ODPOT, which was essentially the precursor database to the Cochrane database. And in 1987, the year before he passed, Archie referred to a systematic review of randomized controlled trials of care during pregnancy and childbirth as, quote, a real milestone in the history of randomized trials in the evaluation of care. And he suggested that other specialties should do the same. His encouragement and the endorsement of his view by others led to the opening of the first Cochrane Center in Oxford, the United Kingdom, in 1992, and the founding of the collaboration in 1993. And so this is the international symbol that most, if not all, of you would be familiar with. And this logo illustrates both our global objectives and our key scientific processes. And you can see there's a circle formed by, a C, and then sort of the mirror image of the C that reflects the international collaboration that makes our work relevant globally. And the inner part of the loop, the circle, the part that you see here, illustrates a meta-analysis, and that's something that we'll look at a future session in the series, from a systematic review of data from 7 randomized controlled trials of a short, inexpensive course of a corticosteroid that was compared with placebo given to women at risk of preterm birth. The first trial was reported in 1972 and another 7 by 81. And this diagram summarizes the evidence that would have been revealed had the available RCTs been reviewed systematically. And so just to briefly explain the diagram, each of these lines here represent a different study in this area. This middle line indicates that there's, if you're comparing a corticosteroid or whatever treatment to whatever your comparison, in this case placebo, that there's no effect, and then one side would favor one over the other. And in this case, when all of the information was pooled together and meta-analyzed, this final diamond that you see indicates that corticosteroids reduce the risk of death of infants by 30 to 50% if they're used. However, no systematic review was published until 1989, and so it was estimated that tens of thousands of premature babies suffered, maybe received more expensive treatment, perhaps even died as a result of pediatricians not knowing sooner that this treatment was so effective. And this is just one of many examples of the human cost resulting from not performing systematic up-to-date reviews of studies of healthcare. So I hope that this sort of sets the stage for the importance of this. If we're to look at the Cochrane Collaboration as a whole, that there are a couple of sort of ideals that sort of surrounds what the collaboration is. I apologize that my terms here are very small on the screen. They weren't like that on my original PowerPoint, but when it converted through, this is sort of what it looks like. But let's walk through these. And so the collaboration is an independent, not-for-profit organization funded by a variety of sources, including governments, universities, hospital trusts, charities, etc. We don't accept commercial or conflicted funding to ensure that our work is not influenced by commercial and financial interests. We have a structured governance, and I'm going to get to that in just a moment. I'm just going to show you sort of a schematic of what might represent the governments or the sort of the work of the collaboration. We have a steering group that leads us. We have a secretariat with a chief executive officer, and we also have an editorial unit where the editor-in-chief of the Cochrane Library, where he resides. We believe in equal partnerships among researcher, healthcare provider, or patient, and that we actively seek those perspectives when we are producing our reviews. We are worldwide, and I guess when I was first learning about the collaboration once upon a time, I was struck by the number of individuals worldwide who contribute in many ways to the work that's produced. So it is an organization without geographic borders. The majority are volunteers, and only a minority of people in the collaboration, like myself, are paid staff. But can you believe that over 32,000 people from over 100 countries make up the Cochrane Collaboration? Many of our contributors are world leaders in their fields of care, healthcare policy, methodology, or even consumer advocacy. And our Cochrane groups are located or editorially based in some of the world's best academic and medical institutions. And we advocate as part of our role. So our core mission is producing Cochrane Reviews, but we are involved in a number of related activities such as evidence-based decision-making and advocating for that, providing training in Cochrane Review preparation, developing the methodology for preparing reviews, and also we have folks who are involved in translating them and in translating trials to be able to be incorporated into reviews. We, as of January of 2011, are in official relations with the WHO. They awarded the collaboration a seat on the World Health Assembly, which allows the collaboration to provide input on WHO health resolutions. And as a result, we are considered a non-governmental organization in official relations with the WHO, which establishes a partnership with formalized communication between our two organizations, which is just a wonderful advancement for the collaboration. So if we're going to look at the principles of the collaboration, so yes, we are collaborative. We internally and externally foster good communications, open decision-making, and teamwork. We build on the enthusiasm of individuals by involving and supporting people of different skills and backgrounds. We avoid duplication by good management, coordination to maximize our economy of effort. We minimize bias by our scientific rigor, the energy that we put in behind the science of conducting systematic reviews, but also ensuring broad participation and avoiding conflicts of interest. And a principle also keeping up to date, so ensuring that Cochrane reviews are maintained by identifying and incorporating new evidence as it becomes available. And to continue on, we strive for relevance by promoting the assessment of healthcare interventions and newly diagnostic tests. We also look at those, using outcomes that matter to people and making choices in healthcare. We promote access by widely disseminating the outputs of the collaboration, taking advantage of strategic alliances, by promoting appropriate prices for groups to subscribe to the Cochrane Library, but also promoting content and media to meet the needs of users worldwide. We ensure quality by being open and responsive to criticism, by applying advances in methodology, as I mentioned, and developing systems for quality improvement. Continuity by ensuring that responsibility for reviews, editorial processes, and key functions is maintained and renewed, and by enabling wide participation, reducing barriers but encouraging diversity of contributors. So I hope this gives you a sense of a bit more about who we are and sort of what we stand on, and if we were to, volunteers I think is a big part of what we do. Couldn't happen without our volunteer base. And so if we were to look at our mission statement, our intention is to help people to make well-informed decisions about healthcare by preparing, maintaining, and promoting the accessibility of systematic reviews of the effects of interventions, but as I mentioned, also newly diagnostic tests. And just to show you sort of our web presence at Cochrane.org, feel free to access our website. We have a sort of a news ticker. We have a news feature. And if you want to find out more about the specifics about groups and a little bit more what we do, or if you want to access the multimedia portal, feel free to do so. And I think one thing that some people don't necessarily make the connection on, and I think is important, is that the Cochrane Collaboration and the Cochrane Library really are hand in hand. And so the Cochrane Library is the main output of the collaboration. It contains Cochrane Reviews, it has other databases, and this is what we're going to look at in a little bit more in depth next week. And so if I was to take a look at the structure, or think about what might sort of represent the structure of the collaboration, and as you can appreciate, it is more or less a web of people who contribute, to the larger output, and it's very collaborative. But if I was to use this image to just sort of give you a snapshot of what it might look like. As I mentioned, we have a governance structure, and this more or less represents our governance. We have a steering group. They provide strategic direction. They oversee the organization as a whole. It's comprised of members from within the collaboration, and we have two co-chairs who lead it, who are sort of voted in by the membership. We have a secretariat, and that's the administrative office of the collaboration. They support the work of the steering group and its subcommittees. They manage central finances. They facilitate communication for the collaboration, and is currently led by the Chief Executive Officer, Nick Royal, of the collaboration. And the Cochrane editorial unit, which is fairly new, and they support groups by improving the quality of the Cochrane Library, and they help to build participation in collaboration activities and the use of Cochrane Reviews to make healthcare decisions, and is led by the Editor-in-Chief of the Cochrane Library, who is currently Dr. David Toby. And I'm going to go through a few of what, bit more detail what these other groups do, but we do have a number of other groups that aren't represented in this figure. We have quite a few executive committees made up of folks in the collaboration that take leadership roles in various areas, whether it's for review groups or methods groups, etc. We also have, in order to make our web presence known, we have we have a web team. We also have an IMS team that takes care of a lot of the structure for RevMan and Archie, and what it is to actually produce reviews. So there's quite a few functions that are related within the collaboration. to take a closer look at review groups. So this is what most of you would probably be familiar with, and that's so the groups that represent a certain clinical area or healthcare area, and they're an international group of experts with interest in that problem, and each group has an editorial based worldwide, and they handle the entire process of conducting and publishing reviews. And so there are currently 52 registered groups worldwide, and 6 of them have their editorial base in Canada. I just flagged this because I'm from the Cochrane Centre in Canada, but we have 6 that occur that reside in Canada. Fields focus on dimensions of health that overlap multiple review group areas. So you think about setting of primary care, for example. The type of consumer, so the child health field is editorially based here in Canada. There's also a field that looks at the healthcare of older persons, for example. It could be the type of intervention, so where it's complementary medicine or vaccines, that kind of thing. And they ensure that their priorities are reflected in the work of review groups and work hand in hand with review groups. We also have, and I just want to make note of the Cochrane Consumer Network. They're considered a field, but just to show the importance of how we value consumers, their input and their work in the collaboration, that they actually have a network that's dedicated to them to be able to support them. And actually the Consumer Network is now technically based here in Canada with the Canadian Cochrane Centre. There are Cochrane Methods groups, and they're responsible for developing the methodology for Cochrane Reviews. And so the Bias Methods group and the Campbell and Cochrane Equity Methods group are based here in Canada, but there's information retrieval, so looking at searching, there's non-randomized studies, statistical methods, etc. There are many different methodology groups that have been formed within Cochrane. And then Cochrane Centers, and so centers support the collaboration on a geographical basis. They promote awareness of the collaboration. We're here to support our members. Training is one. If we have folks connected with our network who want to be involved with translations, then that's something that we can contribute to the collaboration. And we also establish partnerships with organizations within our area. And just to give you a sense of where centers and branches occur worldwide, here they are. The ones that are in blue are the centers, and the red are the branches. And as you notice, not all countries have a Cochrane Center, but all have a reference center located in another country that they can work with. And this is us at the Canadian Cochrane Centre, so this is sort of the folks who are connected here. And we also have a policy office as well that's located in McMaster. So we sort of work between the Ottawa and McMaster sites. And if you want to contact us at any time, that is our email. As I mentioned, centers, this is just a view of Cochrane Canada as a whole, so where the center exists, but then also our various network sites, and because of our geographic expanse, we have network sites that we work through to help with promoting and possibly even training activities. And so, we sort of work, again, collaboratively sort of within Canada for the larger output, and it also shows sort of where the different review groups and methods groups, etc. are. So that gives you a sense of what Cochrane Canada is. So as I was mentioning, Cochrane Centers established partnerships, and at the Canadian Cochrane Centre, we have partnerships with a number of health professional organizations like the Canadian Medical Association or the Canadian Dental Hygienists Association, with health research associations like the Canadian Institute for Health Information, the Canadian Partnership Against Cancer, the Institute for Clinical Evaluative Sciences, consumer organizations like the Arthritis Society, Health Policy Organization, PAHO is our partner officially, and WorkSafe BC actually as well. They're an organization. So they advise on our activities, directions, and then they also in turn promote the awareness of Cochrane and the use of Cochrane. And so thank you to those. I know there are quite a few of you as part of our network who are joining us today, and so thank you for your work, and it's just wonderful to work with you. I just want to pause there to see if there are any questions. I had one that had come through the chat room and asked, does Cochrane Collaboration review only randomized trials? Can observational studies be also reviewed? And so yes, what we'll do is we'll look at that a little bit more in the following weeks. But yes, observational studies can be reviewed, but I would think it's fair to say that Cochrane looks at sort of what is the most robust type of study that should be looked at for a given health question. And in the majority, it would be randomized trials that is the most robust. Work like the Cochrane EPOC group, they have to look at some more non-randomized studies given the nature of their intervention. So if you think of something like mass media where you can't randomize people to what they see on a billboard, then they have to look at other types of designs to look at. So yes, it can be reviewed, sort of non-randomized studies can be looked at, but there has to be a clear justification for it. For adverse effects, also, it's not just randomized evidence that they're using, but they can look at more non-randomized for adverse effects. And in fact, for those of you who don't know, the Cochrane Handbook is available online, freely available, and so they outline some of these things in their chapters if you want to know more information. Okay. Are there any more questions for now? Okay, well, if you think of something, feel free to add into the chat room and I can address it. Do fields move? Oh, yeah, sorry, there was one question that came through. Thank you. And so before I move on, I can answer it. Do fields move and become review groups? That's a good question. I guess potentially they could, as long as, I guess the idea behind a field is that they span multiple review groups. So if it makes sense to have a field take on an aspect that's just a specific clinical area, that they could. But given that, something like children where you look at interventions and there may be certain things you need to think about when looking at trials in pediatric populations, that there may be specific considerations to look at that, yes, it would make sense that they would stay as a field and look at a broad scope. I do note, though, that there has been one field that actually became a methods group because over time they realized that what they were doing was more the empirical evidence behind looking at a particular area. And in fact, that was the equity group. They used to be a field, but now they're a methods group. So so I guess it depends, yes, on their focus and whether it makes sense to actually carve out something that would be unique to a given area and not actually expand across areas. And then another question, do these collaborating partners give directions only, or do they also provide support giving funding in the area of their interest? There's no reason why they couldn't, and so that piece I think would need to be worked out with the leadership of a given Cochrane Center. Let's say I know that there are some sort of health research foundations, for example, that can fund Cochrane Reviews, and so could they become a partner? Sure. I think those items can be worked out with the leadership of a Cochrane Center. But those are great questions. Thank you very much. So let's move on. Let's talk about the importance of systematic reviews. And so some of you may know, and again, I'm sorry for the quality of the slide. It just doesn't seem to want to translate through very well. These terms looked much larger, believe it or not, once upon a time. And so some of you may be aware that different types of reviews or knowledge syntheses exist, and I've listed some of them here. My intention today is not to explain or discuss each of these, but just to acknowledge or make you aware that different ones do exist. If you wish to know more, please feel free to send me an email, and I have some citations that I can send to you if you want to look into it a little bit further. But to look at what is a systematic review, what I've done is I've just pulled the definition that we have in our handbook and in the Cochrane glossary. And to walk through it a little bit, a systematic review has to have a clearly formulated question. You have to have a clearly stated set of objectives to really focus or really make clear what it is that you're intending to do. And why is this important? Well, it should guide the rest of your review. You need to know upfront exactly what it is that you're wanting to investigate, and everything else that you do should flow out of that clearly defined question. And this is what the end user will use to determine if your view, the work that you've done, is relevant. And I think that just makes sense. And so, I think you're you're putting your best foot forward by making sure that everything is clearly formulated, defined, and that everything that falls out of that is clearly defined as well. And so it uses systematic, explicit methods to identify, and so along with those objectives, you need to have predefined eligibility criteria for what it is you're going to include. You need to have a systematic search to attempt to identify all the studies. And with that, eligibility criteria then sets the stage for making it clear what's included and what's excluded from your review. You need to assess the validity or critically appraise the research of what it is that you're assembling together. And you need to have a systematic presentation and synthesis of the characteristics of findings, so the characteristics of the studies and their results. And it may or may not include something like a meta-analysis. So this gives you a snapshot of what it is a systematic review is. And I just want to just draw your attention to the systematic part of this definition. And so yes, it is done or conceived according to a plan. So you have clearly defined what it is you're looking for, what it is you're going to do, and you have that plan in place before you actually undertake the review. And it has to be explicit. It has to be stated in detail, and be nothing implied for the reader, and it should be reproducible. And so I hope this gives you a clear framework for what it is a systematic review is. And what I'm going to do is I'm just going to use my application sharing feature. And what I'm going to do is I'm just going to pop up a sample of what would be considered not a systematic but a narrative review, just to help underscore what it is that I'm talking about. And so what you should see now is you should see this floating box that pops up. And you can manipulate it a bit. So if you can't see the full view, you can take your mouse, take the width of it, and just sort of expand it out. And so once you do that, just send me a happy face through, just to let me know that you're seeing everything that I have on the screen. Okay, so I have some happy faces coming through, and I'll just allow others just another minute to be able to do that. Okay, so let's just walk through this. I'm not going to go through this in detail, but I just want to briefly scroll through. And I'm just going to scroll down, and I'll go slow so that you can see. And so I just want us to take a look. Don't look at the details, just take a look. So we have an introduction. We have, it looks like a little bit of background information, like it's statins and ischemic heart disease, statins and cardiac hypertrophy, inflammation, neuroendocrine activation, just a lot of information, okay, about those areas. Then we get into something where it says safety, looking at the effectiveness on clinical outcomes. And so what you see is, okay, they're talking about one study here, and I'm just going to scroll down a little bit more, talking then about another study. Again, results from a couple of other studies shown here. Then we get into the efficacy of statins and a particular type of cardiomyopathy, and again, just sort of information about a study, another information, sort of description. Okay, and we get to the end, we get to the references, and over here it talks about the efficacy of statins and diastolic heart failure. And here it says, to date, only one study has examined. And so then I look at this and I think, well, how do I know that these articles are the only ones out there? I don't really have a sense of where it is that they looked. Did they pull these from their file drawer? Did they look at their favorite journals? Did they only look at published studies, maybe? How well are the studies done? So it provides me information. I don't have a sense of critical appraisal. What set of inclusion or exclusion criteria, they don't have a sense of, is this a similar group of studies that they're pulling together? And so has it been assembled so that it makes sense to consider them together? And it doesn't, so I don't get those kinds of senses. And so at the end, I see something like this. It says, accumulating evidence suggests that statin therapy is both safe and effective in improving outcomes, et cetera, et cetera, et cetera. So then I look at that and I think, well, if I don't have a sense of where they got their information from, I don't have a sense of how good these studies are, what kind of confidence do I want to place in these findings? How robust are these? You know, what's the overall believability or trustworthiness? And so it's these kinds of things that the systematic review helps to overcome, because it has all of these components set out in advance. And with Cochrane Reviews especially, we publish our protocol in advance. So you know that people have predefined this before they actually go out. So they're not going to be led by findings. They're going to be led by what their intention is. And so I hope that this sort of helps to, I hope I've, you know, set the stage or built a case for what I'm going to look at, and especially in sessions 3 and 4 when I look at the snapshot bits of the process of doing this. So does this make sense to you? Does this resonate with you? And I'm sort of looking for, if you want to send me happy faces through, or if you just want to send me notes in the area or in the chat room, then feel free to do so. And yes, and so somebody mentioned there are blackened areas, and I did that. I sort of blended your information to the article, and I didn't want to draw attention to, you know, the journal it was published in or who the authors were. I just wanted to use it as a teaching tool simply. So I hope that helps to answer your question. I just wanted to take a look at what something maybe not systematic would look like to underscore the importance of what a systematic review is. Okay, great. So if there's nothing further, then I will move on. And I just wanted to have a bit of a brainstorm session. So now that we've taken a look at what a systematic review is, well, what purposes could it serve? And even from your perspective, how would a review help you? So if you can just start, you know, thinking about those questions and, you know, putting information into the chat room. So what do you think an aim of a systematic review would be? What purposes would it help you or even thinking about, you know, what purposes it could serve. Basis for a clinical practice guideline, absolutely. It can provide the evidence base for then going on and making recommendations, because the intention of Cochrane Reviews is not to provide recommendations, is to provide the evidence in a particular area. It might highlight strengths and weaknesses, but the actual local applicability is up to the clinical practice guideline developer. So absolutely. To justify new studies. So there might be maybe a paucity of evidence in a particular area. You know, maybe it'll highlight a gap. So thank you for that. Maybe more research needs to be done in an area. And conversely, maybe there's enough evidence in an area, and therefore, you know, to fund a clinical trial in that area maybe isn't justified, and that better research dollars could be used elsewhere. Build evidence for clinical practices, absolutely. So, you know, looking at what should I be doing in clinical practice in this given area. Maybe it's uncertain. Maybe there's conflicting evidence. Yeah, evidence-informed decision making, absolutely. Thank you for those yeah, contributions in the chat room. That's exactly what it is. To summarize that evidence, absolutely. There's a whole vast array of evidence out there. Somebody needs to take the time, because a clinician doesn't have the time to do that. Okay, great. And someone else said a medical technology assessment. Absolutely, it can be incorporated. So great. Thank you for those items. So let's walk through these. So information management, as my image shows here, absolutely. You can have this stack of papers that, guess what, clinicians don't have time. Policy decision makers don't have time to be able to keep on top of the evidence. So underscores the importance of systematic review and pulling all of that together. Within that, there could be different levels of evidence, and hence that variable quality. And even among randomized control trials, there can be varied quality. And so this schematic is just an image of, you know, looking that there are different levels of evidence. This is not a one-size-fits-all for all types of research questions. You know, but if we think about something like an effectiveness trial where the intervention is randomizable and therefore looking at an RCT is the most robust design for doing that, then yeah, you want to be able to pull together and be aware that there are different levels of evidence, and there are inherent biases in all of those. And I think, you know, research users, so consumers, healthcare professionals, policymakers, you know, they live busy daily lives, and so it can be difficult to find the time to critically appraise. Some of them don't necessarily have the skills or know how to go about doing it, and so systematic reviews can help out with that, help out with the trustworthiness, the believability in a given piece of research. Decision making in healthcare. And so this is sort of meant to represent what evidence-based or evidence-informed decision-making is. And so, it's the incorporation of evidence and information along with clinical expertise and patient preferences. And so it's not cookbook medicine. It's not just this component, but this component is an important part of it. And systematic reviews can feed into this. And it sort of was brought through in the chat room, but, a review can help resolve conflicting evidence, in a given area, looking at uncertainty in practice. Maybe there are variations in practice, and they want to be able to, underscore what is the best practice, confirm appropriateness of current practice, and was indicated in the chat room, highlight the need for future research. So to help with research gaps and, knowing where to focus research dollars. And so yes, at the end of the day, we need a systematic review. And so hopefully, you can view systematic reviews as an efficient way to access research because the search for studies, critical appraisal, the interpretation is already done. Through those can explore the variability among studies and can provide a reliable basis for making decisions. So it reduces bias, in the ways that the review is conducted to reduce bias. It reduces random error, that it's not just looking at one study, but evaluating all the studies in a given area. And that hopefully, people will use this, and it is useful for, healthcare decision-making, healthcare use policy, and future research. So, Cochrane Reviews. So as I mentioned, we look at interventions, we look at diagnostic tests. We want to summarize the evidence to help people to understand it. And we're careful not to impose our own values, preferences, and local context, and that stems back to the idea that reviews can be used for clinical practice guidelines. We keep our audience in mind while writing, knowing that it is used by multiple end users. We all have the same structure format, so once you look at one Cochrane review, as most of you have, that you know where to look for things when you're looking at other Cochrane reviews. And as I mentioned, we start with the protocol, we define our methods a priori, and then we conduct our review. And so to look at the strengths, the methodology, we do, spend our time, energy, and expertise into looking at, what are the best methods for us to be able to conduct these reviews. We look at a broad scope of literature, and we'll take a look at that in the snapshot part in week 3. We update and maintain our reviews. We look at inclusiveness of perspectives, and so by now I hope you have the appreciation that we do, sort of incorporate different viewpoints into it. We have a plain language summary, so it is written so it takes the academic work and puts it in their easy-to-read language to try to reach all end users. We maintain our independence from commercial interests. And I think what's unique about the Cochrane process is that unlike publishing in other journals, that Cochrane provides the support and feedback throughout the process, not after it's done. So you know that you have that larger support, especially if you are sort of new to the systematic review realm, to be able to produce a review. And so finally, if we were to look at ways to get involved, and hopefully this will help you if you consider getting involved with Cochrane if you aren't already. You could become an author, so yes, you can author review, and the ideal circumstances that you're paired up with other people, especially if you don't know how to do a review, that you're with others who do know and that you can learn through the process, but also give your perspective, whether you are a researcher or a healthcare professional, consumer, etc. You can become a peer reviewer or an editor, so if you have content expertise in a particular area, you can provide feedback on protocols and reviews before they're published. And so you can provide the clinical perspective, a policy perspective, a consumer perspective, etc. Perhaps you're an educator. You can provide an education perspective with reviews that the EPOC group does. You become a field member to ensure that priorities and perspectives in your field of interest are reflected in the work of review groups. And you could be involved. They compile specialized databases. You could be involved in that, coordinating activities with relevant agencies outside the collaboration, commenting on reviews, etc. You could become a hand searcher, so that's the sort of page by page, looking at a journal to see if there are trials or studies that are relevant to the collaboration. Each group is assigned a list of journals, and so that's a way that you can help out a given group. And as well at the center we have journals that we hand search, and we provide free online training as well if you're interested. Methods group, so if you have expertise in a different methods area, whether it's statistics or other methodological aspects, you're welcome to join a group. As I mentioned, the Consumer Network, again, I hope you get an appreciation that we do value consumers and want their input. So even though they're listed as a field, yes, we are open and welcome to having consumers be a part of things, you know, and they can help decide what reviews are done, what questions are focused, you know, provide some feedback on protocols and reviews, etc. And as well as a translator. Maybe you can volunteer to translate trials for use if you have, you know, linguistic skill in other languages. And I think it's important for you to know that, you know, there are no membership fees to be a member of a Cochrane group, but your willingness to volunteer and share in the collaboration spirit of goodwill pretty much underscores the type of people that we're looking for. So at this point, I will just sort of pause for questions. Does anybody have any questions about Cochrane? We're going to look a little bit more in the process of conducting the review in weeks 3 and 4 to provide you that snapshot of how they're done. Next week we're looking more in depth at the Cochrane Library. Okay, well, if that's it, oh, it looks like there's something else coming through. I'll just wait for that question to come through. But thank you for your time. This is the end of week 1. What I will do is send you an evaluation form at the end of the series, and then you can provide us with feedback. And in a moment, what I will do is I will send you a copy of my PowerPoint, so if you wish to download that and keep a copy for yourself, then feel free to do so. And I'll just allow another moment for that question to come through. And what I will do as well is if you have any questions, feel free to send me an email, and I'll send my email right into the chat room. It's astevens@uottawa.ca. Does the collaboration provide support for authors to conduct literature searches and retrieve full text articles? That is a yes, and in fact we'll talk about the literature searching component in week 3. So you will find all about that. Okay, great. And I'll just allow another moment if you wish to ask a question. Is there a sort of rule of how often reviews are to be updated? That's something that they're looking at. What the rule of thumb has been to date is about 2 years, but I think it really depends on your area. So, you know, if it's an area with a lot of publishing happening, then it may make more sense to do it sooner than 2 years. But certainly that's something that if it's around the 2-year mark, how often does it go beyond 2 years? That's a good question. But what you can do, what a person can do with a given review, if they feel that the literature is stable at the 2-year mark, they can add that as an update and let people know the stability of the research. Is there a Cochrane group, either review or author group, in the Caribbean? I don't believe that there are any groups based in the Caribbean. That's a great question. Are there authors there? That's something that I can certainly look up. If you're from the Caribbean yourself and you want to know if there are other colleagues within Cochrane there, then that's certainly a way that we can connect you with them, not a problem. And for Jake Hawley, if you want to send me an email if you want to find out more about that, then feel free to do so. Are there any specific training that you would recommend for novice authors who may be based in a country not near a Cochrane Center? So if you are an author, in fact, there are online modules available through Cochrane.org. So for Joey, if you want to send me an email afterwards, I can provide you with a direct link. If you have an Archie account that you can access your review, that's what you use to log into these modules. So yes, for those who aren't able to actually physically travel to a center or travel to a workshop, they started with online modules. Absolutely. And if there's an idea, so if you know, for other webinars such as these, specific area that you feel it's important that you would like to know about, or that you have a sense that colleagues of yours need to know more about in a given area, feel free to let me know, and I can consider that when I'm scheduling the lineup of these webinars. Another couple of questions. How do you obtain an Archie account? So if you're a review author, then email your managing editor. So that's sort of your contact editor that is based at an editorial, at the editorial base of a Cochrane Review group. That's probably the person that you connect with the most often, and they will be able to set you up with an Archie account. You want modules on working with RevMan and GradePro. So I have modules on the Canadian Cochrane Centre's website for RevMan. It's RevMan 5.0. We need to update them for 5.1, but at least give you a sense. That's as a starting point. GradePro, there are new modules now available on the IMS website. So for participant 5, send me an email and I can give you the direct links. And another couple of questions coming through. These are great questions. Thank you. I'm glad you're taking advantage of this time to be able to ask them. And feel free to drop me a note at any time if you have anything further. Okay, so as these come through, what I thought I would do is I can just provide you with the URL for the Canadian Cochrane Centre. If you wish to know more linked through, then you can do that. Here you are. I put that through. That's an active hyperlink, so you should be able to click on it, and you can bookmark it even on your internet browser. What does the South Asian Cochrane Network do? Is that different? So for Priya, thank you for your question. I'm not fully familiar with the Cochrane Network. I would assume it's similar to the one in Canada, where they have sort of nodes of different people who are involved with the South Asian Cochrane Network. More like sort of coordinated effort. But if you're interested in what they do, feel free to contact them. And so that would be, so the South Asian Cochrane Centre, I think they've set up their network, so if that helps to describe a little bit more. And so actually how they function, etc., I don't know the specific details about, but if you wish to contact them, feel free to do so, and I can facilitate that connection if you wish. Is there a particular area or field of study that the organization feels is underrepresented, looking to expand or develop? I know that they're wanting to get more involvement from colleagues in developing nations. So there's a field, a developing countries field, and I know they're looking to, provide more training there and sort of build capacity more in those regions. But if there's a particular thing that you wish to be involved with, then let me know, and I'm happy to facilitate a connection. And if you look at the list of review groups, fields, methods, etc., and it's, if you're in an area that you feel, isn't represented, let's say, then that's something that the collaboration can look at, or if you wish to connect with more people, then that's certainly something that I can help facilitate. Feel free to drop me an email. Can we send the dates and times of the following webinars? So it will be the next 3 Thursdays at the same time. So that's when the ones of this series are. And if you wish to know the fall series lineup, so when we start the next academic year round of series, then you can simply go to the Canadian Cochrane Centre under workshops and events, and you'll see Cochrane Canada Live, and that's where we post. If you wish to be added to the list, if you're not currently on our list, then you can let us know. We can add your name to the list. And yes, I will send a copy of the presentation if there are no other questions. Thank you very much for your time. I hope this has been informative and valuable to you. And so once I stop the recording, then I will send through my PowerPoint. Thank you for joining us, and have a great day.